Obesity risk factors and complications. Obesity is a common disease in most countries, which can be considered a serious threat to health. At the same time, the number of people who care about fitness and maintaining it is increasing, making obesity a significant health problem. The importance of obesity is not limited to preserving fitness. Obesity can increase the risk of diseases like diabetes, cancer, heart disease, and strokes. Losing 5 to 10% of body weight can reduce the risk of heart disease to an acceptable extent. Also, weight loss can improve bad cholesterol, LDL, and blood pressure levels. The causes of obesity are very different. To check the risk factors of obesity, we will first check some things. When does obesity occur? How do we find out about our obesity, and when are we considered obese, and several important questions in this regard that must be answered. First, obesity or overweight is an imbalance between energy intake and energy consumption, which occurs under various factors. In other words, calorie intake is more than calories and energy consumption. How do we know if we are overweight? The tool considered to measure overweight is the calculation of body mass index, called BMI. Body mass index is a measure to check the appropriate weight for your height. In this calculation, the weight in kilograms they divide by the square of the height in meters. You can find the link for BMI online calculation in the description section. According to the BMI table, 18.5 to 24.9 is normal, 25.0 to 29.9 is overweight, and 30.0 and higher is obesity. Obesity risk factors. The factors that cause obesity can be divided into non-modifiable and modifiable factors. Non-modifiable factors include the following. Number 1, genetics. The genes we flare from our parents can have a role in our ability to gain weight and the amount of fat stored in the body, a place in the body that is stored, as well as the amount of metabolism and amount of food conversion to energy. Number 2, age. As people age, their activity decreases. Hormonal changes also cause the accumulation of more fats in the body. In addition to these, the body's muscle mass decreases with age, which leads to a decrease in metabolism and overweight. Diseases and medicines. Some diseases such as hypothyroidism, rare Cushing's disease, which is caused by excessive activity of the cortical part of the adrenal gland and causes fat accumulation in the face, neck, and waist. Polycystic ovaries, menopause, arthritis, chronic pain, and sleep disorders can lead to weight gain by reducing metabolism, reducing physical activity, and increasing appetite. In addition, drugs such as cortisone or steroidal anti-inflammatory drugs, antidepressants, diabetes drugs, and high blood pressure drugs can also lead to obesity in the body. Modifiable factors. Number 1, bad food pattern. Bad eating habits include a wide range of unhealthy foods and fast foods, sugary substances, trans fats, juices, a lack of fiber, and low vitamin and low protein foods. Number 2, inadequate sleep. Changes in sleep patterns such as lack of sleep and too much sleep can cause changes in the level of hormones, and as a result cause increased appetite and weight gain. Number 3, stress. High secretion of cortisol or the stress hormone increases appetite and overeating. Number 4, lack of physical activity. Inactivity causes obesity in the body, but lack of regular physical activity during the day and week is the cause of many other diseases. Number 5, contamination. Contamination caused by chemical pollutants and chemical compounds that we deal with daily can interfere with body weight control. Also, substances such as those found on food labels, such as phthalates and bisphenol A, cause an increase in weight. Complications of overweight and obesity. Number 1, diabetes type 2. Obesity makes the body resistant to insulin hormone, which regulates blood sugar, resulting in increased blood sugar. Number 2, heart disease. Weight gain leads to high blood pressure, increased cholesterol, and fat deposits on the walls of the vessels, as a result of which the heart vessels narrow or become completely blocked. Number 3, blood pressure. You are well aware that weight gain means fat tissue increase. Like other body tissues, these tissues need oxygen and nutrients to survive. This increase in oxygen and nutrients causes an increase in blood volume and pressure on the walls of the arteries, which results in high blood pressure, which can lead to strokes in the heart and brain. Number 4, cancers. Evidence shows the relationship between obesity and cancers such as breast, uterus, colorectal, kidney, pancreas, and colon cancers. Significantly, the role of abdominal obesity in the occurrence of cancers is more evident. Along with other causes of cancer, obesity is an important factor. Along with other factors, it is the cause of happens acceleration of cancer. Number 5, fatty liver. Accumulating fat in the liver makes it prone to liver diseases and cirrhosis. Number 7, kidney diseases. Kidney disease means that the kidneys cannot purify the blood, as a result toxic and waste materials accumulate in the blood. Weight gain increases the risk of high blood pressure and diabetes, the most common factors in kidney diseases. Thank you for watching. Don't forget to like, comment, and subscribe for more videos.